Thank you very much, Teurai, for making time to visit with her Zimbabwe and to do a short interview with us.
You're welcome. It's good to be here.
So you are 2 weeks into a stay. Well, you're here in Zimbabwe for 2 weeks from Australia.
Yes.
Tell us a little bit more about what you are up to and what you've been up to.
Oh, okay. Well, in Australia, I'm running a business called Fitness to a T. So I'm a personal trainer. I've done a nutrition course as well. So what I do is I help clients one-on-one within the gym achieve their fitness goals, with emphasis being on core strength. So that's what I specialize in: flat tummies, people who want six packs and so forth. And I also do online training. So I train clients all over the world, including people in Zimbabwe, for their fitness goals as well.
And how long have you been doing this? Because you have a very varied career as a lawyer, a model, a philanthropist, and now a fitness trainer.
Oh, wow. I guess my story is that when I started off when I was much younger, I went into the law route because I felt that was what was expected of me. I thought it was a good job and, it would give me good money and so forth. But when I actually started doing it, I realized I was deeply unhappy. I was depressed most of the time. And I'd always had a calling for modeling. I'd always been into my fitness. So I started with the first thing, which was the modeling, got into that. And then when I got to the age of 32, I'm 34 now, I decided, okay, I'm going to go for my fitness dreams, because I'd already left law and I was brave enough to continue. So I founded the fitness business last year in January, and I'm really enjoying it.
And how easy was it for you to change from, a profession that might be perceived by many to be, like you've made it, you're a lawyer, you're into law now, and to go into something else? How easy or hard was that for you?
It was very hard, especially I think that I disappointed a lot of people as well, unintentionally, of course. For example, some family members and friends who didn't understand it. But once I'd actually started doing what I loved, it didn't feel unnatural. It felt like I'd made the right decision. And I really feel that I want to live my life being happy. I only have one life to live, and there's no point for me to live it being miserable.
And so you mentioned that you staggered all these approaches. You started with the modeling and now you're into the fitness training. Did you plan your life? Did you sit down and say, I've got 2-year goals, I've got 3-year goals? How did you do it?
I did plan it. I mean, my bigger vision when I decided to leave law, obviously I took a couple of months to transition from law to leaving it completely, and my big theme that I had was I want to do all the things that make me feel passionate. And on the piece of paper that I had, I wrote modeling, I wrote exercise, and also just helping people, doing something that helps people. I felt in law I wasn't doing that. I really didn't believe in the things that I was doing. For example, defending people who'd beaten their wives and things like that. It didn't make me happy. So
Okay.
yeah, it was kind of planned, I guess.
Okay.
Yeah.
And now you also run an organization on the side. You've been very, very modest, not to mention that. You run the Elizabeth Chanakira Trust for cancer patients and survivors.
Yeah.
Can you tell us a little bit more about that, how that came about and why you're so passionate about it?
It came about after my mom Elizabeth passed away in 2010. So during the time that mom was ill, the medications, just the cost of looking after her while she was suffering with cancer here in Zimbabwe was really, really high. And it just made me think about, people who don't have anything at all and who are suffering from cancer. With cancer being the leading cause of death in Zimbabwe, I thought I really want to bridge that gap and reach out to marginalized cancer patients in Zimbabwe and help them as well. So I founded it in 2011, and at the moment we're looking after 4 families. We did have 5, but one cancer patient passed away. We were only supporting him with needs for himself, not his family, so we only have 4 now. But what we do is we help them with food for their families. We send some of their kids to school. As a grassroots organization, we can't pay for all the children, but we choose at least one child that we can help, and then also medical costs.
And how do you sustain such a cost-heavy initiative?
What I do mostly to sustain that is fundraise from Australia. So every year I'm doing fun runs. So for example, in October I ran in the Melbourne Marathon, the 10-kilometer race in the Melbourne Marathon,
Wow.
just to put it correctly. So I get people to sponsor me, lots of fundraising events in Australia. So for people who are helping the families from Australia or even within Zimbabwe, for example, the cost of the school fees for one of the children is $30 a term. So for someone in Australia, if they sponsor me for $30, for them it's not so much of a burden. So I'm able to do that while I'm there.
And the passion to get publicity and information out about cancer is, very timely and necessary. A lot of people live with tumors undetected until they're at a very late stage and are malignant and they can't get help. How do you do any work that is in terms of screenings for cancer or any sort of public awareness raising and destigmatizing of cancer?
At the moment, we're not doing any awareness raising. Our niche, I suppose, is specializing specifically in helping marginalized cancer patients. The organizations like the Cancer Association are very good at raising awareness and, helping reduce the stigmatization. Obviously, with the patients that we come into contact in their communities, we do give awareness and we help with the extended family if they want to know more. But our niche is just focusing on these patients because there are other organizations in Zimbabwe which are doing great work raising awareness.
So what would your advice be as a person with a person who had cancer in their family line? Cancer is said to be hereditary sometimes. What steps or precautions should one take? What steps and precautions should one take even if there is no cancer history in their family line? And what steps or extra steps must someone take if there is cancer in their family line?
I suppose for both sides, it remains the same that, if you suspect anything, for example, women and breast cancer, if you feel any lumps, go immediately to your doctor. Cervical smear tests as well. Smear tests, make sure you go for your pap smear, just for prevention of cervical cancer. And for men are very, they tend to be less willing to go to the doctor for checkups and things like that. So I'd really encourage the men to go for regular checkups. Another thing as well in terms of prevention of cancer within Zimbabwe is, there are a lot of statistics, World Health Organization and a lot of organizations that say that a lot of cancers, not all of them, a lot of cancers are caused by lack of exercise, not eating healthy. So I really encourage people to get more exercise, and even if it's just walking, it's just as relevant as someone who's doing weights. Just getting more active and eating healthy as well, eating local foods.
Now, onto the local foods aspect. I know you're a big proponent of eating local foods and promoting their nutritional benefits. Can you tell us a little bit about, your superfoods? I know you've discussed majanje before as a superfood.
Yes.
Other things that you feel are locally available, affordable, and, that people could tap into for nutritional benefit.
There's plenty. And, as human beings, it's always good to eat things that grow naturally within the environment that you're in. So whether, in America, Australia, it's the same applies. But in Zimbabwe, our murio, all our fruits and vegetables have different benefits, and we tend to sort of ignore them and go for the other superfoods, which might be more expensive, might have been, imported in when we've got so much growing here in Zimbabwe.
So, what other foods would you say? You said murio a little bit.
Yes.
Majanje.
Yep. So all the green vegetables, I would say. All the fruits. I can't even think of one fruit that is not good. Masao. There's just so many mangoes, obviously. There's so many, all of them. I can't think of one that I can say is bad for us.
But you know how it is, people want to go and be seen as cool. So they want to go, to like a fast food joint, have chicken and chips and a Coke. It's a growing sort of social status thing where we say, if I'm seen eating here, it means I've made it.
Yes.
Is there a way to eat that sort of food and maintain your health?
Yes.
Or is that more just like empty calories that we're just downing to look cool?
I think that, you can never tell someone not to eat those things, because it's not feasible. I myself also have, junk food now again, and things that might not be considered that good for you. I think everything in moderation. So, make sure that 80% at least of your diet is healthy, fruits, veggies, wholemeal things like sadza regio is very good. Sadza is fine as well, white sadza. But also have your treats, so that you're not feeling like you're punishing yourself, so to speak.
I think finally, it's a very interesting discussion that people in the diaspora and people locally in Zimbabwe are having constantly about, what to do for Zimbabwe or how to help Zimbabwe. There's also a lot of disgruntlement in between of people who feel that people who've left the country no longer care, and we're the people who are still in Zimbabwe are supposed to then build the country up, with the limited labor force of people and minds and skills. What would you say, as someone living outside of Zimbabwe, you see as a sustainable way of maintaining relevance in Zimbabwe, as well as living your life apart from the nation space?
I guess I can't speak for Zimbabweans abroad, for all of them, but what I can say is that for myself personally, I found a way to be outside of Zimbabwe but also still give back through something which is very personal to me. So still be able to help the cancer patients and keep my mom's memory alive. I think that a lot of diasporans as well are doing different projects. For example, I know people in Australia who are helping with, digging boreholes and projects within their villages where they come from, looking after their family, supporting them with whatever they can if their family is struggling here in Zimbabwe. So I think all that help is very relevant.
So, Zimbabwe is split across many different divides.
Yes.
Can we work together towards one goal, do you think?
Wow, I think we can. I think there's definitely hope there. I suppose there just needs to be more community and certain people leading the way and saying, hey, let's do this. Yeah.
Thank you so much, Teurai, for your time.
You're welcome.